My name is Dr. Paul Cooke. I'm an attending physiatrist here at the Hospital for Special Surgery. Physiatry is a specialty that really focuses on restoring function to patients. It's a non-surgical care. It's really we're experts in non-surgical care of musculoskeletal problems, whether it's spine, back or neck pain, patients with joint problems, hip, shoulder, or knee, nerve disorders, muscular problems, specializing in trying to diagnose that in terms of what's causing someone's pain or dysfunction, and then really what can we do to get them back to what they want to do in terms of getting back to that level of function. And for each individual, certainly that's different. For majority of musculoskeletal problems, we can treat them non-surgically, and that's the great thing. We have an array of treatment options for patients that that are conservative and really get them back to function. And also, part of our job is to know when it's appropriate to refer someone to surgery. I think patient education is very important. When a patient comes into the office, that's the goal that I strive for, is to make sure that before they leave, that they really understand what's going on, what the source of their pain is, and going over with the patient, looking at the films, whether it's an X-ray or an MRI, and showing them in the office what's causing it, or pulling out a model of a spine or a knee or a hip, and showing them the mechanics of why this is giving them a problem, and then really having them understand what the treatment plan is, because often the treatment plan in terms of some physical therapy or certain injections may be to improve the biomechanics of that joint or the spine, and I think if they can see it and see it right in front, and be able to ask questions right as we're doing that, that only benefits them, and I think we get better outcomes that way. As a physician and a physiatrist, my goal is to be able to restore them to a certain level of function, and when we're able to reduce their pain and to get them back to an activity that they love, or maybe it's an activity that they haven't been able to do for years. It feels great. It's rewarding. Patients are very appreciative. That's really what I enjoy most about what I do.